Ready to go?
All right, let's do it.
All right, ladies and gentlemen, welcome to episode 6 of Unsolicited Lifting Advice. My name is Sam.
My name is Manas.
And we have a special guest with us today.
Our very first guest star.
Very first one. It only took 6 episodes.
All right.
Our guest, introduce yourself.
I am Doc CF, Chris Harris. I met these guys back, what was it, probably 2014. I met Manas first.
Chris was my RA.
Yeah, I was already had the misfortune of that experience. And I'm currently a doctor at Columbia New York Presbyterian, starting my intern year, and trying to be an anesthesiologist. So if you guys ever need some work done or something happens, I'm going to be the one that knocks you out. So.
Yeah.
Quick fun fact, I guess, before we get into the substance and meat of the episode. So at the end of October, I took a fall off ye old skateboard. Had this hand in a splint for, it was supposed to be a month. It lasted about a week and a half. Injuries are important. Kids, don't listen to your doctors. Excuse me, do listen to your doctors. And so I distinctly remember giving Chris that call and like, hey, so. And Chris would be like, dude, like, I'm in New York in the middle of a global pandemic. How are you still my first virtual call?
You managed to make everything about you, Manas.
I do what I can.
Yeah. So we thought that it would be wonderful to get some very solicited advice today. We give you unsolicited advice, and we have very solicited, studied for, paid lots of money for advice coming to you today. Don't get used to it. It will normally just be us rambling about nonsense. So, Manas, why don't you bring up this topic, because this was something you wanted to do. I obviously am a big fan of it. We're going to talk about it, but this is your brainchild. So let's get into it.
All right. So, with Chris being here and with 4 years of med school and experience working at a hospital in New York and all of the work that came into even getting into Georgetown Med, casually just flex that for you.
Just drop that in there.
I have the representation.
It's tattooed on his ass cheeks, too.
The left one, right? So, with all of that, last episode, there was a brief minute where we talked about supplements. And we went over, hey, instead of just trying to break down every single thing, which we may do in the future, here's just a quick overview of a couple fun ones, examine.com for all of your supplement information needs, and that covers pretty much anything that you can walk into a store and buy. Now, being the gym, there's a very different sort of supplement, something that's a little less easily gotten. I'm not going to say it's especially difficult,
yeah.
But something you're not going to buy at a Walgreens or CVS. Obviously, we're talking about anabolic steroids.
Yes.
And so,
yeah, Mark McGuire.
And so we'll get into a larger discussion about what we think of them and everything as well, I'm sure. But I thought it'd be nice to have someone with an actual education on with us to address this topic.
Yeah.
And just talk about what these things actually do to you, and then have that as our kicking point and see where the discussion takes us.
Yeah.
Sounds good. All right. So first of all, I guess none of us ever have done.
I have not ever taken steroids. No.
I did consider getting some just for this episode.
To take live on air, to be administered by a doctor.
I mean, if you're gonna have a needle stuck in you, you probably want. That's okay. Jokes aside, obviously we live more on the natural side of things. No judgment at all towards anything. I think we've talked about this a lot off air, where I think largely it is a personal decision made by an informed adult. As long as you are not using your steroid use in order to just manipulate others, being like, hey, like, you use this, you got these results, and then be like, oh, well, like, actually, I followed this training program, which you can buy from me for $49.99, and as long as you do that in 6 weeks, like, as long as you're not using that to lie to others, as long as you're being upfront about your use, I think it is a personal choice that should be made by a well-informed adult. And that well-informed part is where we're kind of getting involved.
Yeah, so, steroids, and when we think of the stuff that people use to, help them gain a little more mass, gain a little more strength, they are sort of based on what's sort of naturally occurring in the body is testosterone, and pretty much like a lot of the variations of, because it's not, you don't just have to inject straight testosterone, they have the chemists and all that stuff that can rearrange it to still give you some of the similar effect, but it is like a normal part of your body, and without it, the body starts to fall apart. Like for guys, I think you hear a lot about like low T, and you see all those commercials like, here, take this supplement, and like all of a sudden you'll be having all the sex you want with your wife now in your 60s. And so it is, like I said, it is sort of a naturally needed component in your body, and when you are going to supplement that, or when you want sort of that boost, you're just kind of kicking it sort of more into overdrive, what it was sort of naturally supposed to do, which particularly men, when you hit puberty, start getting more testosterone production, start building more lean muscle mass, strength is sort of associated with that, then undergoing all the other changes, facial hair, all that stuff, acne, that comes when the steroids start getting produced. And so when you are looking into, and it's kind of like the studies and sort of the benefits, or like what are the steroids actually doing, it's really interesting, because they have meta-analyses, they have all these great studies that have kind of looked at the effects, and you do see sort of the positive effects in increase in muscle mass in particular, and then a mild increase in strength, but then when you start getting to like those nasty sort of side effects, the adverse effects, they always will throw in the disclaimer, well, we did the study as best we could, but we don't know how honest people are being with their doctors. Very similar thing to when either of us gets asked, how many drinks a week do you have?
4, doctor, just 4.
So, studying stuff like that, and trying to actually get like really nail down what are the benefits, what are the harms, is difficult, because like you said, and I think you're doing like a pretty good job of like trying to destigmatize, like, oh, like if you're using steroids, you're a terrible person. And to each his own. If you understand the risks and you're kind of willing to accept that, that's your own choice and your decision. But it is tough to make sort of an informed decision if you don't have the best evidence. I mean, you can go off of what you know and what you can read on like Wikipedia or something like that. And in my case, like what we learned in medical school, like what we would expect if this person came in and they were using steroids. It's not as clear cut, and then obviously everybody's so different, so they're going to have different reactions right off the bat. I think kind of one of the, and you don't hear too much about it because there's not, they're not really particularly like common conditions, but just the use of steroids just medicinally as well, like use of testosterone for, like I said, for older guys that they're running low on testosterone, but also for kids who delayed puberty, like that will sometimes treat with testosterone to help give them a boost, to kind of kick into gear, because sometimes this whole body thing, like if you're awkward and gangly when you're a teenager, imagine what your body's doing on the inside. It takes a while to get it going. And some other stuff, it was originally used to treat like cancer patients. So like if you had like a really bad like blood cell cancer, you needed a bone marrow transplant. It was originally part of the treatment and sort of like the management of I think it's post bone marrow transplant, like sort of reconstituting the immune system and everything, so that they're not going to die when someone just like looks at them the wrong way. Right. So steroids, like I said, when we think of the risks of steroids, because if I were just to tell you, hey, I'm going to give you this, you're going to see an increase in muscle mass, you're going to see increase in strength, maybe not as much as the muscle mass, but get more muscle, can build it up, build its strength. You'd be like, oh yeah, sure. Like, why wouldn't I do that? I'm going to the gym to get cut. I'm going to the gym to work on my physique. Why wouldn't I want something that's going to help that? And that's when we start talking about the adverse effects. Some of the stuff is mostly to do with like your cardiovascular health. So it messes with your cholesterol levels. You tend to see a rise in the quote unquote bad cholesterol, LDL, and a decrease in the good cholesterol, the HDL. So you see sort of risks right there. But again, that's when we think about that, that's sort of more like a long-term risk. That's not, you're not going to immediately drop dead.
That's tomorrow Sam's problem.
Exactly. It's one of those effects that you're not necessarily going to see the effects from right away. Some of the other stuff that is, not necessarily lethal, but is kind of what steroids are sort of known for, is the roid rage or changes in your personality, your mood, aggressiveness, irritability. And again, like just kind of looking through the studies, there's not like the super conclusive, like, hey, if you do steroids, like you're going to turn into this basically human version of the Hulk, just not green, I guess.
Yeah.
Hopefully.
Hopefully, but there is an association between steroid use and a certain percentage of steroid users developing these sort of hypomanic or more increased aggressiveness type symptoms. And then the other stuff that you start to think of is, again, more rarer, but like you can have cases of like liver failure from an interaction that I apparently did not pay attention to in medical school. It's listed. Kind of real, like, probably first thing you'll start to notice is sort of, changes that would have been a good thing, sort of maybe as you were going through puberty, as you started to notice how your body was changing, but then you kind of get the reverse effect of that, because what happens is whenever you supplement something in the body tends to respond, oh, well, I'm just getting it from this. I don't need to be actually making this for myself.
Yeah. So that's the guy's balls shrinking kind of thing.
Exactly.
You don't need to be producing testosterone naturally because you're getting it this way. So your testes shrink because they're not doing what they were designed to be doing.
I think it was Rich Piana that pointed out that if those are smaller, other things look bigger. I do hope I'm attributing that quote correctly. But
Rest in peace, Rich Piana.
But in having said that, it can only look so much bigger if it can't get up. So that's the other problem that comes with not having sort of your natural testosterone in your body sort of shutting it down. You can have erectile dysfunction, changes in your libido one way or the other, whether it's increased or decreased. Because remember, we can give you straight up testosterone, but usually these are modifications of testosterone, or they're in the same family and have a similar effect, but they're not testosterone itself, so they're not going to have all the full range of effects that it plays in your body as an important hormone.
Right.
Another fun side effect that you can get is gynecomastia. So, if you want to go from a B cup to a double D, it's very possible if you're using steroids.
Yeah.
And that comes from more of actually having too much testosterone. What will then happen is stuff starts to get sort of filtered down other pathways, and you see more conversion to estrogen and the changes associated with having too much estrogen just in general in males is increased. Yeah. Increased fat deposits in your chest, so that can be.
Do you want tits?
Are you sure?
And then you have like the sort of other, I won't call them milder side effects, but to some extent, parts of your body will be affected by taking something that is as important as testosterone as a hormone. Acne is another sort of big thing.
The pepperoni back stuff.
Oh, my back hurts just thinking about that.
But a lot of the stuff is again, it's how long will it take for this stuff to sort of develop? Some people built differently. Maybe they won't develop. The testicular shrinkage, all that stuff in the same time frame, or whatever, any of the other side effects. And so when you're kind of going into, if you were to make the decision, hey, I'm gonna use this to help boost my own my gains, as it was. It can be tough to see, like, well, like, you know, maybe I'm one of the lucky ones. Maybe I won't get all these bad side effects. So.
Yeah, I think it's I guess as we kind of move forward in this discussion, foundationally is you should speak with the doctor if this is something you're considering, whether it's for personal use or if you are getting into high-level bodybuilding. Let's be completely honest. All of those guys, if they're competing at Olympia level,
you're on stage as an IFBB pro.
Yeah, and that was really taboo. Like, for a long time, Arnold and them, that whole era, denied using steroids at all. And obviously, as the years progressed and it became more and more acceptable, they're like, oh yeah, we was like, well, duh, but it's becoming becoming more and more.
And I will say, like, on that note, the way that I started this off with the, hey, like, it's personal choice, and as long as I've had time to think about how I wanted to phrase all of that, which is why it was so concise. I think one of the little things that comes in there is kind of a devaluing of the achievement because, oh, you use steroids. Like, okay, no, this is still just, you could use steroids and that isn't going to get you there.
Yeah.
There's still just an unreal amount of work that goes there.
Yeah.
Like, every single thing that's in play in natural bodybuilding is still in play there. This is just an additional factor.
Yeah. It just helps. It helps with recovery. Obviously, there's the ability to gain more muscle mass as you increase your natural or increase your testosterone levels via whether D-ball, tren, whatever combination of chemicals you end up taking. But yeah, no, you definitely need, I think you put it perfectly, this doesn't devalue Remy or Phil Heath or any of them. Like, they're still in the gym for 7 hours a day. Yeah. Their nutrition is still on point. This isn't a free ride in any way, shape, or form.
It is not grab and control, like up, RB, X down. Like, that it doesn't just automatically get you there.
I like the GTA one and not the Konami Go.
But like, regardless of, you could use this and still, statistically, you still wouldn't get up there.
Yeah. And
so, hey, like, kind of just, if we frame this from a discussion of, this isn't, do you want to use the cheat code or not? And it's just, hey, this is, do you want this desired end, knowing that comes with these caveats?
Yeah.
I know, like with myself personally, I think the biggest thing that stops me from looking at using them is because it's, like, when I stop and think about doing things naturally, and I'm like, this is already an overwhelming amount of information to try to just fine-tune and like, okay, what's important, what's not, when, like, going through all the nuance of when do I want to use this, when is this applicable, what am I stressing about, like, something like, for example, I personally don't use BCAAs, something like that's, it's just not, it hasn't been shown to do enough where in my mind I'm like, it's worth it. Still does something, but I'm like, there are so many factors in natural bodybuilding that now you just bring in another factor, you're bringing in another variable that I personally don't understand nearly as well.
Yeah.
And I'm like, I already have a difficult enough time with all these things I need to manage. I would much rather just focus on that and see where I get.
Yeah, nutrition and working out are hard enough to get right. Get right. I quoted there for those only listening. But that's hard enough to do well alone. And then you're adding in this X factor of exogenous hormones. And again, like you said, the literature is still a little, people haven't been super honest about what they're doing, so it's kind of hard to make large, conclusive statements.
I think the fact that was kind of most surprising, because when you hear about steroids, you think about like Major League Baseball, the Olympics, and stuff like that. But I think the statistic that was kind of like surprising to me when we were reading about this was that 1 to 3 million Americans have used some form of androgenic anabolic steroid, whether it was for weightlifting purposes or some fitness goals, or one of the sort of other medical uses that you can use it for. But I still thought that was a pretty significant number, and even then it still may be underreported just because people aren't comfortable talking about it, thinking that, like almost similar to like hard like Schedule 1 drugs or something like that. So and the other thing that I think you guys were kind of trying to get at, because you hear sort of like the buzzwords nutrition, and then like how much working out, and like how much time you put in the gym and stuff like that. At the end of the day, your body's going to do what it's going to do at sort of baseline in response to those things. You have your own sort of blueprint, genetically speaking, that will respond in a certain way to these things, and some people will respond by massive gains in their muscles, but then also maybe developing some sort of like some dietary issue or something like that. So it's all of this is, again, like you were saying, these are sort of pieces that you can consider when you're kind of wanting to pursue sort of a fitness goal or change how you want to eat. But at the end of the day, like how you respond to it is going to be very just much on yourself, and it can be tough comparing it to somebody else who all of a sudden had this huge boost in their either their performance or got the physique that they wanted, and it's taking you a little bit longer.
And that, I mean, I think right there at the end, you had a lot of good things. One is everyone's different genetically, so what works for me won't necessarily work for Monis, will work for you. And then we're men, so then women have a whole nother set of things that they have to be working out when they want to make these fitness goals. And then comparing yourself to others, and like, that's not, you shouldn't be getting into any really weightlifting in general, but definitely not into extracurriculars if it's, I want to look like that guy. It's like, there's a lot of stuff that goes into why he looks that way. Maybe steroids is one of them.
Now, I'm not gonna look like Ramy. I could start today.
You will never look like that guy. I will never look like The Rock. I'm like, there's just and then I think you brought this up another episode, but like all the way down to like muscle insertions, like you physically have like your lats insert different places than another person, so there's no way you're gonna 100% look like any other person other than you. So if that's just reason why you're thinking about, let me dabble into upping my supplement regimen to this, is like, well, that's a big red flag.
That's taking a very major decision for exactly the wrong reasons. And in the end, that's where that well-informed bit comes in, because at that point, if you think that's how it works, at somewhere along the way you've been misinformed. And in that case, you're taking something that comes with major just lifestyle changes, and you have an expectation of, well, that means I'll achieve this. And when that's not true, okay, if you knew that wasn't true, would you still have done it? And again, when we frame this, I think especially just with that, like, for so long it was such a taboo thing that even just talking about it makes it sound like we're going back to that framing. We're not. It's just like any sort of major lifestyle change should be well informed, and this definitely falls into that category.
So we've talked about steroids purely for the kind of competition reasons. You brought up testosterone replacement, which is something that's kind of gaining popularity now. People I follow, Joe Rogan talks about it, and the process that he went through is step one, you go to a doctor, and they do your blood work, and they say, okay, let's check and see what's happening right now. And then they go, okay, what's your diet look like? They try to dial that in. Once you get the diet, what's your sleep like? Try to dial that in. What's your activity level? They go through all these steps, and then if at the end they go, okay, how do we get you back to normal? And again, normal is the baseline. I assume they would have established via all the blood work and stuff. Then we can talk about whether it's taking testosterone, or I think for some people, you can just tweak your diet, tweak your exercise, and that helps a lot. Past a certain age, although I think that you just kind of stop producing it and lose the levels before.
I mean, as you get older, your body starts to say, yeah, I'm done with this. Like, it's not just gonna hopefully crap out all at once, but the amount of testosterone that you produce as you age goes down, and so there are certain age-related sort of norms that's what we're kind of measuring against. And then you sort of have the side effects that come with that, low energy, reduction in libido, possibly erectile dysfunction, all that stuff, loss of just in general muscle mass, which is both sort of a natural process of aging, but as you're losing the normal sort of level of testosterone that your body was used to, it's going to also have an effect as well. So the testosterone replacement therapy, to be honest, I haven't seen too much of it or heard of it, because I see most of my stuff comes from like the commercials that you see for it, or like the weird advertisements with like the 70-year-old that looks like he's 50 or something like that. It's like the eugenics or whatever that I think it is. I haven't seen too many patients in my experience that were on a form of testosterone replacement therapy, and I think it's sort of one of those things where, if you're coming in, like you said, with I'm not feeling like myself, low energy, and things aren't working the way they used to, the doctor's going to kind of work you through all of this other stuff first before kind of seeing like, oh yeah, well maybe we should check your testosterone and see where that's at. And again, but like we talked about with the side effects for steroids, same sort of side effects for testosterone replacement. Delivery methods are a little bit different. So for when we think of anabolic steroids that you would use in like a fitness sort of setting, or for the other medicinal, it's usually pills or injections, whereas testosterone replacement therapy has both the pill options, but then also has sort of these creams that you can apply, and don't necessarily, you can avoid the needles with that, but those come with sort of like the interesting, even more sort of interesting slew side effects, where like if you are using sort of a cream like that, like you're applying to your shoulder, you have to be very careful about what you sort of touch afterwards. Like, say you're a parent and you have a child. You can there's a funny league episode about this, but like it can happen, like early virilization of the kid from having too much contact. Like, it's not just like if you accidentally touch him once, it's not going to
it's not chemical X, but
trigger the puberty cascade at the age of 3. But it like if you're not being careful, if you're like sort of just rubbing it over yourself, and that's definitely a risk that you can see affecting
giving grandma
not just yourself.
But so I guess the takeaway from that would be you don't need test boosters under the age of, well, definitely like our age. Like no one our age should be going to GNC and getting a test booster.
Essentially, because if you're kind of at that point, we might have other issues that probably need to be dealt with before you start supplementing that. And again, like especially, I can't imagine like me in medical school thinking like, shit, it's my testosterone. I'm tired all the time. I'm gaining weight. I'm losing muscle mass. Like, or it could just be.
Do I need sleep?
The 3 hours of studying I have to do after going to clinic for 9 hours. I think at this age, if you'd have to start sort of noticing more other physical symptoms, erectile dysfunction or other stuff to kind of maybe start to trigger that discussion. It's more as we get older, 40s, sort of 50s, where you kind of start having that. You can maybe start having that conversation. With, I'm not saying you can't have that conversation. I'm saying would probably be a better time than at the age of 25. Like
more advisable than to at 25. I need to boost my tests. Like, no, I think you just need to sleep and stop drinking Monster. Maybe water. How about water?
Just every now and then. Also, this is broccoli. These are what vegetables look like.
And for guys sort of more like myself who are trying to get once the whole COVID thing, and we can go to gyms and not have to wear masks and act like we're dying of asthma, like but for guys like me who could stand to like put on some more muscle and start getting back more into a fitness routine, the the benefits of like reducing just your natural body fat can also be sort of a natural boost to your testosterone, because the fat cells have an enzyme that can actually convert it sort of back into estrogen. It's called an aromatase. It's a fancy science word for basically, instead of making testosterone, now you're getting some extra estrogen too. So sort of other natural way to boost your T is just exercising and losing weight, essentially.
Yeah. That's to a level though, right? Like I think from my understanding, like you start getting like stage lean at that point.
Oh yeah.
Testosterone just like doesn't exist anymore.
Yeah, it's not like you're gonna it's like you keep working out, you're just gonna never ending cycle.
Yeah. There's biological limits to some of this stuff.
That's this for the same reason that when you supplement testosterone artificially, the rest of the body kind of shuts down its sort of natural production. Your body has its own ways of saying, okay, we're making too much of this, let's tone it down a little bit, guys. Like we're at a good level now, and that's kind of just how just normal self-regulation that your body can do. And what you were talking about, like, you're not just constantly never-ending cycle of testosterone.
The age-old adage of like, your stage lean bodybuilder who just can't get hard because he's a stage lean bodybuilder.
Yeah, your body doesn't have enough anything to do other. It's like all systems diverted to keeping you alive right now. Yeah, we'll work on boners after we've sustained oxygenating the blood.
Yeah.
And to like the cutoff, like it's the same reason why you can't have let's call it a 500 calorie a week deficit and lose the same amount of weight every single week. Eventually, your body goes, whoa, what's going on? We need to, because your body doesn't really want to lose weight in the traditional sense of like cutting down to that level. Yeah. Like obviously, you want to maintain a healthy balance, but definitely. Like the idea of constantly losing weight at the same rate freaks your body. Because like, we're starving because there's no food around. We got to start keeping stuff.
Yeah. And also like that's where you have to like assess. We're going into side things, but like that's where
how strange,
how out of character. Like you have to. I personally do it every 3 to 4 pounds, but you have to reevaluate your calories just because if you start off at 200 pounds and you cut down to like 150 pounds. There's a lot less you.
That's a quarter of you.
That is a quarter. Yeah, and obviously I purposely went extreme.
Yeah.
But like the diet that lost you a pound a week at your starting point probably would put weight on at that end point. Yeah. So you have to just adjust as you go.
And then realize just the timeline's going to change, even if you are correctly. You're at the right deficit.
Yeah.
If you're, a couple months into trying to lose weight, your body's trying to figure out, why am I losing all this mass? Like, what's going on?
Yeah.
And then that's why the concept of like refeed periods where you get your body back into we're in a good surplus now. We can, afford to lose some more weight kind of stuff. Because you can't just go downward like that forever.
Yeah. You just can't.
And then there's weight you can't lose, like your bones. Okay, I guess you could lose bone density. But
the easiest way to lose like 20 pounds is just take off your arm.
Yeah, chop a leg off.
You can push you to sleep for that if you don't have an arm. Which
that was one of the wildest things of like old school medicine was like, here's a rag and some bourbon. I'm gonna start sawing. And then that was like, all right, this is a good idea.
Yeah.
The name of the game was definitely speed. You had and also having 3 or 4 people to hold the person down. Because your body doesn't like it when you start cutting stuff off. And I don't think, just because now we're talking about amputations, I don't think people realize, unless you've actually broken a bone, how painful it is to break a bone. you have a ton of nerves that run through it. It's very like when we see like a skeleton, we're like, oh, it's just like hard stuff, but there's a marrow and there's blood vessels and everything like that, and it's incredibly painful to just saw because it's not even just like a break where it's like snap and then your body like ow. This is saw continually, and Definitely makes me glad that my profession came around.
Yeah, the anesthesia. Bless up for anesthesiologists.
Yeah.
So I can feel. I mean, I've heard of the people who like wake up mid surgery or whatever, and like either they can't move or like they can feel like stuff being pulled. They can't maybe feel the acute pain, but there's like something's happening and my body's like,
Yeah. So I think two points to that. So I think the weirdest thing that going through like my rotations when I got to my OB-GYN rotation, it was seeing C-sections for the first time. Because the mom's still awake, they do what's called a spinal, either a spinal block or an epidural to essentially numb pain down. Ideally, you want an epidural, but sometimes if you either not as good. If you were like me trying to do an epidural now, you'd be turning it into a spinal.
What'd you order again? This is close enough.
Or if whatever reason you'd have to choose one or the other. But essentially, what you're doing is you're taking away pain, and you're not going to be able to really feel your legs, not really going to be able to move. But you take away sharp pain. You still have the sensation of pressure, and I wouldn't exactly call it dull pain, but you can feel, or the mom can feel sort of the pulling, and unfortunately the tearing that goes on when like they're delivering the baby, because under an ideal C-section condition, it's planned, the mom got their time, everything's good, but under like sort of not, I wouldn't call it an emergency situation, because at that point we're just gonna knock you out and get the baby out as fast as possible, but it's sort of like a semi-urgent, like baby's not looking so great, we might want to hurry this up. You're gonna feel that in one way or the other. It's and the same thing with like just a natural delivery as well. Even if we give you an epidural, you are still going to feel the pressure. You mentioned about people being aware during surgery or like waking up, and it definitely happens, but it's not as common as you sort of think. Like it's not like in my limited experience of I would say a couple months of watching anesthesia procedures, I've never seen it, and a lot of my attendings that I've talked to, they've never seen it. But again, do they actually know if the patient had this? 'Cause, maybe they were aware. They just couldn't. They just didn't say it.
Couldn't speak or anything.
They either didn't remember it, or because that's the thing. Like anesthesia, the medications we use, it's some of them are it's Versed will affect your short-term memory and your ability to form new memory. So maybe you were awake and you just don't remember, which is probably for the best. But we have
what a weird like. It happened. Can't remember it, so it didn't happen.
See, normally when we make that statement, we're not talking about general anesthesia.
No. I'm talking about generalized bourbon.
So we have this this concept called MAC, which is it's a basically acronym for fancy science words. But what MAC is essentially is like the sort of level of anesthesia that you're at for a particular drug. So like at a level of 1 MAC, we would expect 50% of people to not feel surgical stimulus. So the first incision. So that's what whenever we say, oh, like we're gonna give them 1 MAC of this drug, that's what that means. It's 50%, and then you can obviously go up to like however much MAC you want. So if you're like at 2 MAC or 3 MAC, then you start getting more into like 99% of people won't feel surgical stimulus or something like that. I'm forgetting the exact numbers, but there is what we call MAC aware, which is kind of where like it's like, I think it's a level of like 0.3 or something like that, and that's where like you can feel stuff, and you're just not going to necessarily be there enough to respond to it. So we play around a lot with that, especially because when surgery's done, we want to wake you up and make sure that you can breathe on your own. Because, it was a really long case, and we know that we're going to leave the tube and get you up to ICU. So we will start, playing with like turning off the gas, maybe having like, the propofol sticks ready just in case like you're waking up a little too early, and you're still closing you up, and we need to just shh, go back to sleep. It is definitely one of until you actually sort of do it, you don't really get to appreciate the balancing act that is bringing someone, both putting someone into a coma and then bringing them out of it in a timely fashion so that the surgeons don't yell at you. Hurry up, because they have to start the next case.
Yeah. I recently saw a video of Steve-O, and it's kind of been floating around, but he's like, you can't knock me out on the king of pain, and they do something, and it's like, it's that, because I've had a couple, so I had a major knee surgery, ACL was ruptured, so I had that repaired, I've had wisdom teeth taken out, and it's like, for my ACL, I remember being wheeled, they put you in the gown, the doctor came in and made sure, is it this knee? And I started being like, is it that knee? I hope it's that knee. Like double check it, and then I remember them wheeling me in, or they gave me something kind of on the way, and I remember them wheeling me in, and I'm like, that's pretty cool, I wonder when it's gonna, and then I was waking up. Like there's no, like, it's not a drift off where you, it is, I was looking around like, oh, this is kind of cool, talking to people, and then I was waking up very slowly. It's like kind of pulling yourself out of mud. They had these like, because they had these things on my feet that were like alternating pressure or whatever. Yeah. And that was the first thing I remember, like, what is going on with my feet? And then you just slowly come to, and like then your eyes come back, and you're just looking around like, all right, okay.
That reminds me of, so I had 4 teeth removed when I got braces, and I had a similar sort of, like, going into it was just, we're having conversation. I think the last thing I remember was just, hey, so, like, what are you planning on doing with the rest of the day?
Nothing.
Yeah. And then the lights were off. Someone might have been home. And I remember coming to, and they had a wheelchair just right there ready for me. It's like, all right, we're gonna wheel you out to the car. And I remember supposed to be like, no, it's fine, like, I'll just walk. And like, no, we're gonna wheel you out to the car. It's like, no, like, I got it, like, I feel great, don't worry about it. Like, I appreciate you, but don't worry about it. I'm good. And I distinctly remember one of the doctors being like, oh, you know what? All right, man, just do me a favor, just stand up for me, all right? Just stand up and take one step at me. I'm like, absolutely. I stand up, I'm still holding on to the chair. I'm like, see? And he's like, all right, one step. I'm like, okay. Just immediately, he immediately has to catch me. He's like, all right, so wheelchair. I'm like, wheelchair.
I came through after my wisdom tooth surgery. I was sitting up in the chair, and the one of the dental assistants, I'm not sure of her actual title, I apologize to her, but I don't know, maybe she's a doctor, who knows, but her name was Sam, and I remember that when she's going in, and that's my name, and I remember reading her name tag, and it said Sam, and I'm like, oh, hey, my name's Sam too, and in my head, I was being smooth, I was cool, she was cute, and then she goes, yes, it is, and I'm like, I've said this 7 times in a row, haven't I? And I'm just remembering this one. Cool. I'm going to shut up now and just sit here. But the way it was like, the way you talk to a child, like, yes, it is. And I'm like, damn it, I've said this a bunch of times, haven't I? I'm going to sit here and sulk now.
Still don't have any good, like, person coming to story. Like, what was like the funniest thing to say? So I haven't gotten really any good ones.
I'm sure you'll get.
I will. I'm sure I'll have them. Like, I'm still waiting for like the first like. Oh yeah, that. Because you can get. I think for the most part, most people when they're coming out of it, they'll obviously not know what's going on, and they don't really fight you. We had a couple people fight you, and my favorite memory from one of my favorite OR memories from med school was the 5'2" surgery resident standing on, or like essentially like pinning the patient on the bed while we wheeled him to back. We were just kind of like, here you go. We don't have any more fentanyl, so bring that up. Because it was like a 70-year-old guy, and he like woke up and just
started
crashing. And so, like, I'm holding one arm, the circulating nurse is holding the other arm, and the surgery resident's starting to climb up because he's starting to like jump up. Kids are also ridiculously strong.
Really?
Kid coming out of anesthesia, that guy wasn't like, I could at least hold his arm down and be like, stay. You're not going in.
Yeah.
But kids, because they just, I mean, it's like you hear about people like who do PCP, and they just all of a sudden like they're like lifting a car or some shit like that, or like getting tasered 15 times. Yeah. Kids have essentially, it's just no realization of what's going on. They start moving every which way.
Yeah.
You can't hold them down.
Jeez.
They start slipping through, and they're small, so a little bit hard. You can't be as, I guess, forceful with them because you don't want to hurt them. So it's just the worst scenario. So if you get a very upset kid coming out of anesthesia, those are sometimes almost way worse than adults, because also for the most part with adults you can always have again the backup six approach.
Yes.
Yeah.
And good night.
All that unrealized muscular potential just shooting out of them.
Exactly.
That fight or flight kicks in. They don't even know what's happening.
The same sort of thing as you mentioned with like PCP and like lifting cars up, like the mothers who like break things in the process, but just pick a car up when their kid's underneath, and just there's something. I don't even know how. I don't nearly know enough to try to explain that.
Well, actually, to your point, it's your muscles. It's your nerves telling your muscles not to hurt yourself.
Yeah.
In those situations, like when those situations are like going on, like if you try to pick up a car now, your body would be like, no, you're going to do something stupid. But in those cases where you sort of you block that that nerve connection to the muscles, and then they can just go to town and do what they were supposed to do. That's when you get those scenarios. You will also snap your muscles off your bones, tear ligaments and stuff like that. And to really sort of illustrate that point, whenever you see someone that gets struck by lightning, and you see them like shoot off 10 feet. The lightning didn't do that. That was their muscles.
Like, get out.
That was not that, like, because lightning, it's electric, it's just current.
Yeah.
Nothing like that. No, what's moving them, or like if you've ever shocked yourself and you shoot back, part of that is reflexive in that scenario. But like if a lightning bolt struck you, you're not really gonna have any reflexes. Except your muscles just all in one sort of uncoordinated motion firing, and you like taking off 10 feet.
Yeah.
So. Yeah, so
that might be my new favorite medical fun fact.
When I heard that, because like it's one of those things that you don't think about. Like you're like, oh yeah, when someone gets struck by lightning, like like they get thrown.
Thousands
like,
upon thousands of volts or watts, or
something to do with like the
unit
lightning.
of measurement.
There's some force associated with this. I didn't pay attention in physics.
Yeah.
I heard that and I was like, oh, that makes so much more sense.
That is so wild. Your body's just like, not here. Anywhere but here.
That does somewhat remind me of, I know this is a theory, at least last I read about it was a theory. But like when you're going for a lift and your arm's stuck and it's just like shaking, you're slowly getting that weight up. It's like, okay, like your nerves are telling your muscle to stop, you're gonna hurt yourself, and then your brain's be like, no, like belay that.
I think you might have sent that to me because I was thinking the exact same thing here, where it's like your nerves are going no, but then your body's like, no, we know we can do this, like we've done this before, and it's that weird interplay of you literally fighting yourself to allow yourself to do it. I'm
just mentally picturing. At that point, my body's a pirate ship, and it's Captain Barbossa and Captain Jack Sparrow. Just yell like, belay that.
I mean, there's guys who will tear biceps, like lifting. That's deadlifting is one that gets it a lot.
I saw footage last week of someone going for a preacher curl and tearing it, and then it just settles and like right at the top.
No, thank you. Oh yeah, it just rolls up like a fruit roll up to the top of your shoulder.
So when we did preacher curls yesterday, guess what was going through my mind the entire time?
Since we're circling back to what we originally started talking to, steroids can have an impact on like the sort of the integrity of skin and like, tendons and bones and stuff like that. So it's actually probably more likely that you will injure yourself using steroids because of how we see it sometimes with like not necessarily the sex hormones, but like cortisol. But again, to make testosterone, you need to go through cortisol at some point. So you're going to get some of that like crossing over effects. But I'm forgetting the more medical term for it, but essentially like the body structures start to sort of more start to break down. Because even though it's an anabolic hormone, well, you need to go somewhere for what you need to make stuff.
Yeah.
So, you can see,
Yeah, I mean, thermodynamics still
Yeah.
is in play. You're not creating matter.
Yes.
weakness of ligaments and tendons, and then that a very unfortunate
Jeez.
scenario
Yeah.
happens more likely. And you put on all this size now,
But I
and
say, if
increase
you're-
your strength,
yeah,
so
yeah.
now, like, you're really running the risk.
It's
You're
this
actually
weird,
one of
like
the-
this way kind of thing.
Those videos are absolutely wild. But let's see. 'Cause there's
People like ripping muscles.
Yeah.
Yeah, not a fan of injuries
I like
in any
it.
way, shape, or form.
I like it when the things stay connected to where they're supposed to stay connected.
Yeah. When I hurt my knee, like I didn't know I had ruptured my ACL, but I don't even remember a ton of like acute pain when it happened. I remember we were playing flag football with intramurals. I'm running into the end zone, and the guy, he just ran into the side of me. And I remember rolling, because I scored, obviously. And I stand
Obviously.
up, and I'm like, ooh, no. I go down, and I remember kind of like shaking, like, my legs shaking.
Yeah.
I'm like, okay, that's different. And I could tell, like, because, I'm down there, they bring me ice. And our quarterback, shout out Luke Reddig, his mother, he's actually a surgeon now, ironically, or unironically. But he couldn't help me there, though. But his mother was also a doctor, and she was on the sidelines. And so she came over, and she's looking at it, and I'm describing what it was. And she's like, yeah, I think you tore a ligament. And I'm like, nah, it's not it. Because, I know better than a literal doctor. But I remember standing up, and I didn't play because I could tell. Like, I just knew, like, if I plant, my femur is going to go one way, and my tibia and fibula are going to go the other way. So I sat out the rest of the game. Didn't get an ambulance. I actually went to an exam the next day. I had to be like I slept at a buddy's dorm closer to where the classroom was. And they literally had to carry me over, and then I think I got crutches from somewhere, and I limped back afterwards. But then I went to the doctor, and they're like, yeah, no, they did the MRI, and they're like, you see the space right here? And I'm like, yeah, there should be a little white band of a tendon or a ligament, right there. It's not there, like, at all. Like, you ruptured this, so let's schedule the surgery. Like, okay.
Yeah, I'm thinking back to both of mine. I've never tore a ligament. I'm gonna knock on some wood right now. With the two injuries I've had, there's the ankle from soccer where had a slide tackle coming from behind. Immediately just went numb. Got helped off, but I played the second half. I played the entirety of the second half.
Yeah.
Adrenaline's hell of a
You know what I'm saying? Yeah.
Ooh, adrenaline. And then with the wrist, I didn't even notice anything that night. Came home, just cleaned up my cuts, went to bed, and then the next morning went to take my blanket off myself, moved the hand over, tried to pick up the blanket, and just the blanket didn't move, and I had just shooting pain go up, and that was when Chris got a call.
To be fair, luckily most of my friends, and you guys included, you don't completely abuse that and call me. But I always love it when people are like, oh yeah, my friend's a doctor, I can call him, or when family members ask that kind of advice, because pretty much our default is going to be okay, we'll listen to your symptoms, we'll be like, oh okay, yeah, so you should go see this other doctor and have them actually take a look. I feel like the number, I think that's what ended up happening with you, is because the way you were describing it, but I can't take a look at your wrist.
So you can't remotely run an MRI for me.
Exactly. I'm just Monis, I think you just need to go to an urgent care and get an X-ray. There's not much I can do for you here, bud.
I appreciate your trust in me.
Yeah.
That being said,
Well, I think at least in my case, anecdotally, my mom always talks about whenever I complain about hey, this hurts or I feel sick, my mom hits just code red panic.
Yeah.
Because she's the amount of pain you must be in order to verbally acknowledge it. And so I think it's that same sort of symptom of hey, I'll bother you, but I don't want to be showing up to emergency care and then having be this is a pack of ice, use it for 20 minutes, leave me alone.
Yeah.
So like kind of just the like, hey, like I need you to validate that this is worth going.
to an emergency room. I definitely played like a whole like second half of a football game with what I think is a sprained foot, and I played the rest of the season on that. Because again, like you get hurt, and that's a more contact heavy sport, so you know you get bumps and bruises, blah blah blah. And I remember landing on a foot funny. And the next day being kind of stiff. But, like, that's kind of normal. And, you know, it wasn't terrible. But I remember, like, a week or two later, I was sitting in the senior lounge and just with my feet up. And my buddy came up and slapped my foot. And I almost punched him in the face. Like, hey, buddy. But, again, like, I didn't say anything that, you know, whatever. That's kind of just happens. But I'm, like... Yeah. To this day, I'm like pretty sure I sprained my foot somehow during that because planting on it hard gave me pain. Like I could push off it pretty well, and I was a lineman, so I had needed my feet, but planting really hard hurts. I kind of knew how to stop without giving myself pain, but I'm like, ooh, I probably, like looking back, I'm like, I probably should have had someone look at that in some capacity, but
and that's the thing, especially with ligamentous injuries, you know, if it's like an ACL or PCL, something that we can actually fix, sure, we'll do that, and we'll, you know, either reconstruct it or repair it. But when you start getting into like these little, you know, ligaments of your foot, especially around your ankle, because you have a significant number of ligaments just all around the ankle joint, and when you roll your ankle, probably very likely that you sprained something, but then what are you going to do about it?
Yeah.
Because it's not like you can go in and replace a ligament. And ligaments, unfortunately, are, you know, one of the body's tissues that are the hardest to heal because they don't have good blood supply. It's the same thing with cartilage and why you go on to develop osteoarthritis is because cartilage has a very, very bad blood supply. And if you don't have blood, you don't have nutrients, you have stuff to repair the cells, help them grow new ones. So once you sort of, you know, having said that, if you decided to go to the doctor, they'd probably be like, okay, well, ice it, rest it, keep it elevated, you know, maybe wear a brace every once in a while. But I promise you that, you know, 7 years from now, it's still never going to be the same.
Oh, well, the foot's fine now, so I guess whatever it was wasn't...
See, I still feel it in my ankle when it rains. If we have, like, a real high humidity day, I just need to wake up, I'll know.
And it just, again, like major core theme. Not that I'm like telling you guys that on your podcast, but probably the biggest core theme of these episodes will be everybody is different.
Yeah, no, we talked about that day one.
I'm pretty sure almost every single episode. It's like remember, this isn't like we're telling you things that work. For us. And, or have worked, like, hey, this is how it went for a client. This is how it went in this case. These are trends.
Yeah.
But there's a reason why, like the first thing we kicked off this with, when we started digging into the meat and substance of anabolic steroids, was, if you want to see how this will affect you, talk to a doctor. We brought one here with us. Unfortunately, much as he couldn't do an x-ray for me over the phone, he will not be able to tell you, dear listener, exactly how this will affect you.
Specifically talk to a doctor that has actually trained or done a residency fellowship in this case, it would be either endocrinology or whatever. I haven't heard of any, but there's a variation with a focus on nutrition or fitness. You want someone who sees this every day. There's a reason why you want the surgeon that's done 10,000 of this one surgery as opposed to the one that's only done 100. So well, I can sit here and tell you all that I learned for my board. So you want to go to someone who's actually used these medications and seen their effects, and can, you know, easily sort of find the studies that will, you know, can help you make that best decision. Especially if you're sort of unable to, if you're not really familiar with how medical literature is written and how studies and like what you're looking for and what makes a high quality study, essentially.
All right. Well, that's an hour, boys.
That's a pretty good way to cap things off.
Yes.
I guess. Thank you, Chris, for coming on.
This has been really fun. We'll definitely have you on again at some point, as your schedule allows and our topics crest into your area of expertise, or don't. We'll have you on for random things too.
Yeah.
So it'll be fun.
You can hear about how none of us should have survived 2015.
Yes. Oh yeah. That'll be a series of episodes
that'll be
at some
a thing.
point.
Am I allowed to give some like unsolicited advice?
100%. Yes.
Okay, gotcha. So my weight loss trick, right? What works for me is become an intern. Go to medical school, do your 4 years, go into a residency, and your first year, I promise you, especially if you're doing surgery, you will lose at least 20 pounds. I can promise you.
All right.
That's a result of stress, not eating, generalized anxiety.
Generalized, exactly.
Not being able to eat because of work.
Yes. Can't get out of surgery long.
calories.
It's like intermittent fasting, but for 32 hours in a row.
Yeah.
All right. Well, thank you everyone for watching and or listening to this episode. We appreciate your support as always. Follow us on all of our socials at ULA Podcast. Again, this episode will be. We're working on when it's going to come out.
Yeah.
But
By the time it's out, we may be on Apple. We may not.
Yeah.
I guess if you're listening to us on Apple Podcasts, welcome
You
to
found
Apple
out?
Podcasts.
Yeah.
We will definitely, if you look at any of our socials, so that's Instagram, Twitter, and TikTok, we have our link tree on there.
Mm-hmm.
And that currently has links to our Google Podcasts and our Spotify. The moment... We're not going to wait for an episode drop. The moment that we get confirmation that we have been accepted
by the big boys.
By the Big Apple. We will have that link uploaded.
Yeah, all hail the ghost of Steve Jobs.
Yes. So now that I've properly cut you off.
That's fine. Again, thanks for listening. We will see y'all in the next one. Follow us on our socials. DM us, tweet us, everything at ULA Podcast. Use hashtag unsolicited lifting device, hashtag Team ULA. Thank you. We love all y'all. See you in the next one.
Have a good one.
See ya.